Good afternoon, everyone, and welcome to our employee town hall meeting. I would like to introduce to you Mike Rembes.
Well, welcome, everyone. Nice to have you listening in today. A lot has happened in the last few weeks, and we have several important updates to give to you before we get to your questions. Don't know how much time we'll have for the questions today, but some good information to share with you. So thank you for being here. This week is our Guardian Angel Recognition Week. Typically, our foundation selects Guardian Angel recipients based on donations made in honor of healthcare heroes, and they have a banquet. But given COVID-19, there's no banquet this year. And with the tremendous sacrifices of everyone at Maui Health, the foundation has chosen to recognize all of you as Guardian Angels. The foundation and leaders are making rounds in every department this week with a small gift and a copy of a really neat Guardian Angel publication that was sent to thousands of homes on Maui. Special thanks to the foundation for this wonderful honor, and thank you for all of you for your continued dedicated service. We will hear from Melinda, head of our foundation, a little bit later in the town hall as one of our guests. As you may have heard, the governor has once again pushed back the date for trans-Pacific travelers and the pre-testing date requirement to September 1 instead of the previously scheduled August 1 date. The governor indicated this was in response to the rising cases, not just in Hawaii, but on the mainland. We all read the paper or watch the news, but on Sunday, Florida hit a record of the most cases in a single day, 15,300, going past the former record set by California of 11,000. To put it in perspective, the most the state of Hawaii has ever had in one day is 42. Nevertheless, we want to be concerned and careful. It may be appropriate to delay the opening, even though it is devastating to the economy. I know a number of restaurants are closed for good, and unfortunately, including the Kitchen in Kahului. So it's going to be tough on local businesses to be surviving another month or two without visitors. But we all know we need to keep the health and safety of each one of us and our friends and neighbors in this community top of mind. A difficult situation for sure. While most of the increases have been on Oahu, we are beginning to see a slight increase here on Maui. Most of them are relating to travel. And we are prepared, and we have the experience now to manage any additional COVID cases if and when they come. We'll hear from Dr. Shea a little bit later on our surge plan, but let's move on to our agenda. As usual, we have our EOC leaders here to provide an update. Of course, Joyce, we wouldn't be a town hall without Joyce updating us on PPE. And Kelly from Infection Control will provide us an update on eye protection. We also have Christy again from Employee Health updating us on some of our leave benefits. And as I mentioned, Melinda from our foundation will join us in just a little bit. Okay, let's start off with a quick update from our EOC team. Dr. Shea and Debbie. Debbie, you want to start?
Certainly I will. Good afternoon, everybody. If you could look at your slide, we thought we changed up the slide a little bit for you. And on the left side, it shows the latest cases in Hawaii as of yesterday. And as you hear, and as Mike said, Hawaii is increasing, and you can see the numbers there. Yesterday, the increase was 22, and for Maui, we are up to 135. And on the right side, we have the other states, and you could see, and again, this is as of yesterday, and we've gone up to 61,000 new cases as compared to the prior day to 58,000. And then you show state by state. California went down a little bit from the day before, but they're still at 7,000 plus a day. Washington, D.C. was at 1,000 and luckily dropped to 500. And Oregon spiked up a little. Nevada, a significant jump, so those of you going to Las Vegas might want to rethink that. And then Arizona is pretty plateaued. And then the death rate has jumped from 482 to 787. And then you have our regular slide that we usually present. And nothing's really changed except the top of Maui County cases at 135. And then we would like to celebrate, but cautiously, our 61 days without having a COVID positive patient in-house. However, that celebration needs to be tempered, and we have to make sure that we continue to be vigilant and at work and away from work about wearing our masks, washing our hands, and practicing physical distance so we can keep our Maui numbers down.
Well, thank you, Debbie. Dr. Shea.
Thanks, Mike. I'm going to start my comments off a little bit somber tone. As many of you know, Maui Health lost one of our special people, Lori Chalk, over the weekend. She passed away, I believe it was Friday night. There's really no words that can console those of you who knew her. Lori was an amazing nurse manager up on 5 South. She loved her nurses. She loved her job. She loved the patients. I know a lot of you are heartbroken and that this wound is still very raw. I just really want to let you know that we are hurting too on the EOC. We sympathize with what you're going through. And I just really want to say it's okay to cry about this. Cry with one another. Share the great stories and the memories that you have of her. And we'll get through this together. On a slightly more upbeat note, we are planning a blessing of the units on July 24th. Based on the news that I just shared, it really can't come at a better time. We are going to have, it's about a 2-hour blessing that will include areas outside of each of the entrances as well as several of the units in the hospital. The unit managers have all the information and we'll be circulating that. We encourage those of you who are not working to consider coming in. We'd love to have you. We would just ask, of course, that you go through the usual screening process, have your ID on, wear your mask, and maintain physical distancing. But we really wanted to do this to help us as a group get past what we went through with the last surge and really bring us together as a family to be ready for the next surge, which we know is coming. And with the loss of Lori, that will be added consolation for us. So we really hope that you will be a part of this. I will definitely be there myself. We look forward to seeing you. Thanks, Mike.
Thank you, Dr. Shea. Okay, let's move on to Joyce and get our usual update on our PPE supply. Joyce?
Sure. So the first slide you see here is the chart that represents days on hand for PPE supplies as of this morning. Our days on hand is based on our current usage at this time. And according to this chart, it's showing 4 categories of PPE that are less than our targeted 60 days on hand. From our last update, we noticed a few items fall below the 60-day on hand target, and they are gloves and wipes. So the usage of gloves has increased, and the inventory on hand did not increase, so our days on hand reflect only 26 days worth of gloves. But don't worry, we've checked in with the storeroom, and they have a shipment coming in tomorrow that will help us replenish our supply. For our wipes, these continue to be a constrained item. And as mentioned, the days on hand have decreased right below our 60-day target at 59. We need to keep up with our disinfecting protocol as it is helping us to conserve wipes for the appropriate cleaning tasks, and we wait anxiously for another shipment. We are happy to report that our Bouffant supply has been replenished. This was accomplished by Kaiser National Supply Chain's ability to find alternate products that can be sourced as well as our own ability to find outside vendors who have provided supplies. The next slide. What we wanted to do is circle back because it seems like the same question is coming up again around our Cintas Easy Care clinical white mask that we've been using. The labeling on the existing boxes that hold the masks show a PFV greater than or equal to 95% at 0.3 micron. And so that's instead of what we want, which is a 0.1 micron. What you see here is, I sort of just blew up a specification sheet that came from the manufacturer. Kaiser National Supply Chain also has the FDA certification to ensure that the level of protection is truly a PFV greater than or equal to 95% at 0.1 micron. The printed boxes were not updated, and so this is why we have the discrepancy. And, we just want you to know that actually when we first received these masks from Kaiser National Supply Chain, we immediately contacted them. We wanted to clarify because we saw the same thing. So it was really important for us. We wouldn't have put it out if we didn't gain an understanding of the protection level of the mask. And just for added assurance, National Supply Chain also went as far to send these masks for independent testing and has confirmed the protection level. The next slide. So while we just talked about the white clinical mask, I'm actually here to also talk about a mask that we're going to be moving to, because as you know, due to global supply constraints, we have to be looking for other manufacturers, distributors, and sourcing is challenging. So again, before we're rolling something out, we're researching and confirming the protection levels for each item, each PPE item. So what you see here is a picture of two blue masks, and you'll see the one on the top right hand or middle right hand, and that's going to be what the clinical mask looks like. So this is going to be replacing the white mask that we had just talked about. It provides the same protection as the white mask. It's got the BFV rating of greater or equal to 95% and the PFV rating of greater or equal to 95% at 0.1 micron. The tricky part is we're really going to need to pay attention because you folks know that the cover your cough non-clinical masks are also blue, and we're going to continue to use the ones that we have been using. So you'll have to look when you're picking up your mask, make sure that if you're looking for a clinical mask, you're going to find one without any markings on it. The cover your cough mask is the one that has BYD electronics on it, and so it'll look like this. And so we'll be sure to let you know and have some information at the area in which you pick up your mask, so you don't have to memorize this. But again, this is not rolling out tomorrow. We wanted to do our best to communicate to you as far ahead as possible, and we're going to do other communication on this. That's it, Mike. Thank you.
Thank you, Joyce. Boy, we did a great job getting some more Buffons, and Joyce continues to just do whatever she can to find more PPE supply and add to our supply. So thank you, Joyce, for what you're doing. As I mentioned, we are prepared if a COVID surge was to hit our shores. Our EOC team has been working hard behind the scenes with many of our hospital departments to develop a surge plan that will meet the demands of a potential surge or spike in COVID-19 on Maui. Dr. Shea had the opportunity to present some of this plan to our community at the mayor's press conference last week. And I asked him to join us today to provide a high-level overview of some of the things the EOC team and others have been working on. So, Dr. Shea, can you share with us?
Thanks, Mike. Before I launch into the surge plan, I neglected to mention when I was commenting about the blessings that we are also working closely with Kula and Lanai to have blessing events at those sites as well. Just wanted to make sure everybody was included. So, moving on to the surge plan. So I did go to the mayor's press conference on Friday and present some information, and I'm going to summarize what I presented there today. So I did give an overview about the EOC, Many of you already know who we are and what we do, but just as a reminder, we're a group of physicians and nurses and infection control specialists, as well as administrators who coordinate together to make sure we are as prepared as we can possibly be to manage COVID issues and to keep you and our patients safe. We continue to work with all the departments on surge planning, and in addition, we're working with DOH and the county on any community issues that might come up that we can help them with. In addition, we have something called a crisis triage team. So we are on 24/7, 365. It is a subset of the EOC with the incident commander, Debbie Walsh, and myself, our infection control specialists, and Christy at Employee Health, and our contact tracing team and our communications team. And basically, when we have positive patients or staff members, we coordinate to make sure that the folks who are positive are notified, that we do appropriate contact tracing and notify anyone who is exposed, and that we communicate with you, our staff, as well as our community through our communications team. Our surge plan, so this is the 30,000-foot view. Basically, we have plans in place to use the space we already have available in the hospital to increase our bed capacity from our 219 licensed beds to 300 beds. We are actively sourcing PPE, as Joyce updates you every time we're on the town hall. That is going on a constant basis. Our goal is to have 60 days on hand for PPE supplies. And in the event that we are not able to get up to 60 days, we do have the massive machine of Kaiser Permanente National behind us to supply us with what we need. We're also monitoring beyond PPE. We're monitoring pharmaceutical levels, as well as just day-to-day supplies, IV kits, and all of the things we need to take care of patients. We also are looking at various modeling for staffing as well as provider capabilities based on various levels of surge. So please know we are prepared. We are also working with state and local government should we have a surge large enough to require help outside the walls of our building. And that's all I got.
Well, thank you very much. I appreciate it. Great update. I appreciate the efforts you, Debbie, and all of our department leaders have put into this plan to ensure that we're prepared. I'd now like to turn over to Kelly from Infection Control to provide an update on the new recommendations from the CDC on eye protection for healthcare professionals. Kelly?
Yes, Mike, thank you for having me today. So we're just going to jump in. I have 3 points I'd like to touch on today. First being eye protection, then we'll move into declination, and of course masking. So first thing, eye protection. As of July 7, 2020, the CDC has issued new recommendations for the direct patient caregiver in regards to eye protection. And this is pretty much based on the new incoming information that COVID-19 community spread is increasing nationwide. And they're also looking at the fact that it is increasing as the asymptomatic and pre-symptomatic persons are identified. So what does this mean for us at Maui Health? New guidance emphasizes the importance of applying prevention practices. So we're going to make sure that we are following social distancing. So that means make sure that if you're in an enclosed space like our break rooms, when we are unmasked, to maintain our social distance. We are going to also do frequent hand hygiene, environmental decontamination, ask our patients to wear masks when we're in close contact with them, and now we're going to add eye protection to that. So the CDC goes ahead and breaks down eye protection recommendations in 2 levels, and it has to deal with community spread. So no to minimal lists eye protection as optional, while moderate to substantial transmission, they list their guidance as recommended. So at current time, Maui County transmission we're at a minimal. That has to deal with the fact that from July 1st to the 10th, there was 10 new cases, as of July 1st till today, we have 10 new cases reported. And all of those numbers are either returning travelers or household members of travelers. So once this number does change and we are able to document a positive community spread on the island of Maui, Maui Health will require eye protection as part of our direct patient care PPE. So in latter months, face shields were presented or given out, handed out on nursing units and patient care areas, as well as eye shields, safety glasses. So those are going to go ahead and be your eye protection. And if you need a replacement product, please don't hesitate to ask your manager. So the important things that you're going to look for, of course, with the eye protection is this is for direct patient caregivers. We are going to also make sure that our eye protection covers the front and side of our face, which means that personal eyeglasses and contact lenses do not meet this type of requirement, and that it's going to be made of a material that's non-porous and wipeable. Due to the fact that we are going to ask that these eye protection be used for extended period of time, with the exception being when we are caring for isolation patients. So if you are caring for an isolation patient, please take that time to stop before you're leaving that area and go ahead and disinfect your eye protection there. Next, we're going to just jump on to patient visitor mask declination. I know that there's been multiple questions coming up. You know, what if my patient refuses to wear a mask when I go ahead and try to provide my care? So the most important thing I can just emphasize with everyone is just education. So we want to take that time to make sure that we are educating the person on why this is important and why it's beneficial for us as well as them. You know, if they still refuse, we do have an algorithm or a flow chart, so please ask your manager for more information on that. We can offer telehealth visits if that is acceptable in that field of care that we are providing. And of course, if nothing works, we can escalate it up your chain of command. And then finally, I'd just like to touch on infection prevention points. As always, we want to make sure that we are spreading aloha and not germs, right? So in addition to our hand hygiene, our social distancing, I want to just make sure that we all understand the importance of wearing a mask. So prior to van entry or Maui Health provided transportation, please make sure that we put on our mask, as well as when we are getting ready to head up to the PCI entrance for our symptom daily check and mask handout. As my newest member of the IT team, Randy, and I were speaking about, this would be a great opportunity for us to go ahead and wear those generously provided KP masks. And that is all I have today, Mike. Thank you very much.
Thank you, Kelly. We really appreciate it. We can all be confident that Kelly continues to stay updated on the latest recommendations from the CDC and ensures that we are following and many times exceeding the recommended guidelines from the CDC. Thanks again, Kelly. And now, what would our town hall be without having Christy here for an update? Christy's here to share important information on our extended COVID leave benefits for our employees. Christy?
Thank you for having me back. As you mentioned, we're going to discuss the temporary benefit. This is for COVID-19 positive leave hours. They have been extended through September 30th. This benefit is basically available to eligible employees who have symptoms consistent with COVID-19 and they're awaiting their test results for COVID-19, or they have tested positive. And this benefit is available from April 1st, 2020 through September 30th. They need to be used by October 31st. So if you would like to use this temporary benefit, please reach out to your manager. And if you were screened with your primary healthcare provider, be sure to provide the next necessary documentation, such as the test results, any medical clearances that were given to you. And then also on the next slide, we're going to go ahead and just talk about, as everybody has mentioned in here, is, you know, even though we don't have widespread community transmission on our island, we still need to, you know, COVID is still with us. We need to protect ourselves and others. So just as a reminder, even when you're not at work, wash your hands often, and you want to avoid close contact, and especially if somebody is sick in your home, you want to maintain that 6-foot distancing with that person that's sick in your household if possible. Have them self-isolate. And then outside your home, we want to continue this social distancing, or it's not really social distancing, you're maintaining a physical distance of 6 feet. We still want to see each other, we still want to, you know, socialize, but we need to have that 6-foot distance between ourselves, especially with people that you don't live within your household. And that's because, remember, people can still spread the virus even if they don't have symptoms. So that brings us to, as Kelly mentioned before, this is a great opportunity to wear those KP provided masks when you're out in the community or when you're in transition or transit on public transportation or Maui Health transportation. Clean and disinfect daily, monitor your health daily, and at work, follow all infection control guidelines. And then remember, when you guys are on your break, whether you're inside the break room, if you're outside in the courtyard, maintain that 6 feet. Wear your, when you're talking with each other, wear your mask. And also, I would recommend avoid carpooling at this time because of the, you're not able to social distance in your car. And be safe, protect yourself, and remain vigilant at this time. And that's all I have, Mike.
Well, thanks a lot, Christy. Those are important reminders for us to remember. It's so important, simple things, but it's going to make a huge difference for us all. Thank you. And thanks for giving us an update on our benefits being extended. That was great. We can continue to do that. Now, let's welcome Melinda from our foundation to discuss our Guardian Angel program.
All right, thanks, Mike. Good afternoon. It is Guardian Angel Week, and I just want to give a quick shout out to the foundation staff, Cassie Chavez, Ui Cordero, and Jenilyn Alkane, who actually organized this entire week. I'm super grateful for them, and I just want to say thank you. So thank you. So if you have not been visited yet, we have more presentations today and tomorrow. You can check the schedule at the Foundation's SharePoint page. It has been a wonderful time coming to your department and honoring you as our guardian angels, and we look forward to more visits today and tomorrow. The Foundation and marketing have set up a virtual wall of gratitude at www.mauihealth.org/guardianangel. Many community members have sent and continue to send messages of gratitude and encouragement to our caregivers. Please take some time to go read the current messages. We will update the messages weekly. And one last amazing announcement. Hotel Wailea has donated quite a few gift cards for dinner for two at the restaurant at Hotel Wailea and a grand prize of a 2-night stay and dinner for two. We will be announcing the winners on Friday, and I wish you all good luck. And mahalo again for your passion and your commitment to our community, and thank you for being guardian angels. Thank you.
Thank you, Melinda, and thanks for all that you and Foundation and your team does to recognize our healthcare heroes. They're all guardian angels taking care of our patients, and what we've learned in the last few months, they're guardian angels taking care of each other as well. Now, I think we have time for just a few questions, so let's get to the questions. Gracia?
Our first question is a two-part question. I saw a bunch of posts on Facebook about our census being dangerously high. I know our census is usually pretty high, so can you share at what threshold or number would it be something that is concerning? The second part of the question, when we had COVID patients in-house, our census were really low, like 60%. Why do you think it's so high again with no COVID cases?
Dr. Shen, you want to try to help us with that? I'd be happy to jump in as well.
Thanks, Mike. I will do my best to tackle this. Thank you for bringing this up. I know there's been a lot of controversy about this, and I want to start by doing a little general comment around census in general. It's really important to understand that a census number is really just a snapshot in time, and that it's a very fluid number, even within a day. It's not unusual for our census to vary and for us to near our capacity. That happens not just here at Maui Memorial, but at every hospital nationwide. Census management is a commonplace thing, and we do it all the time. Certainly, you know, when we have patients in the wintertime, you guys all remember when we have patients holding in the ER for days on end, that's concerning. But we deal with that. And so I know people got very excited about the situation last week, and it was a busier day than we'd had in some time, which leads me to address the second part of the question. Our census was really low during COVID. Because we had gone out and messaged to all the people, please don't come to the hospital unless you're really, really sick. And so people stayed home. So our census was really low. And now we've been telling people, hey, come back to the hospital if you're sick, we need to take care of you. And they've done that. And so I think we're back to normal function at this point. I think that things will continue to change, but I reassure you that despite whatever we're dealing with the census, we will take care of the folks that need to be taken care of. We will find a way to do so. We always have, and we will continue to do so.
And I think you'll agree with me, Dr. Shea, that the postings we saw on the social internet were not accurate. The reality is, as busy as we may be, we're not as busy as we were when the visitors were here. So we also should take some great comfort in knowing we have the capacity with a lack of visitors here for the foreseeable future to take care of all the needs of our community.
Thanks, Mike, for adding that. It is really important to restate that the numbers that were posted on the internet were not accurate.
Thank you very much. Let's do another question.
Our last question will be, I recently read that scientists are saying that COVID is actually an airborne virus. Is that true? Does that change our droplet protocol?
Kelly, can you help us? I'm sure glad you're here today.
I'm going to go ahead and try to take a stab at that, yes. So on the inception of our warm units here at Maui Memorial, once we got into the groove of things, we rolled out enhanced droplet precautions, and it's kind of a hybrid precaution. So while we do follow all the precautions in our droplet policy, we added in there the use of N95 masks, which are a requirement for the care of a PUI or a positive patient. And this is due to the fact that while this virus acts like a droplet virus, the virus itself is much smaller, which is why the N95 is of use. And this is supported by a lot of evidence. You know, I know that some people question, but that is definitely why a hybrid version of our precautions were rolled out and very successful. Thank you.
Well, thank you very much. Well, we thank you for your questions. We'll try to do some more at our next town hall, as much as time will permit. Hope you enjoyed this one. As a reminder, your EOC Digest and our employee newsletters are now combined into one publication and will be distributed on Friday. Please take the time to read the document. A lot of people put a lot of time in to make sure that you can read several important updates and reminders. And for the sake of time, not everything was included in the town hall. So you may want to read the issue that comes out. And we're trying to provide you updates on what's happening in the hospital, not just COVID-19. As always, continue to send your questions to our EOC email. We'd be happy to do that. And if we can, we'll answer them both again in our new digest, or we'll answer them at the town hall. Or we'll reach out to you directly if you want to put your name on it. Again, thank you for joining us. If you continued support, we'll see you at our next town hall scheduled for July 29th. Have a wonderful rest of your work week. Remember to continue to wear a mask, practice social distancing, good hand hygiene. Just be safe, and have a great day, everyone. Thanks a lot.
Thank you, Mike. This concludes our town hall meeting for today. Thank you for joining us, and we wish you a great afternoon.